Barness here, board certified psychiatrist. If you're watching this, you're either a student that's rotating with me or you are an enthusiast on the subject. Regardless, I'm happy that you're here. I love you all. Today you're going to learn about antipsychotics. Here we go. Listen, here's a list of them. First generation and second generation. First generation also called typical antipsychotics. Second generation also called atypical antipsychotics. They all block D2 receptors, all of them. Every single one except for three. So they all block D2 receptors, except for these three right here, which are Abilify, aripiprazole, Rexulti, which is brexpiprazole, and Vraylar, which is cariprazine. So they all block D2 except for these three. These three, what do? They're actually partial dopamine agonists. All right, but partially is what they do. But all the other ones block D2 receptors. Now, the ones that are stronger at blocking D2, because they all do them to different degrees, are the first generation typicals and the second generation atypicals, the ones that end in done. So if you see that it ends in done, risperidone, paliperidone, ziprasidone, iloperidone, and lorazepam, those are the ones that would be stronger D2 receptors. Now, if you're a strong D2 blocker, like the ones I just mentioned, you're more likely to get something called EPS, which is extrapyramidal symptoms, which is also movement problems, which we'll get into later. Now, what makes the atypicals atypical is that they hit an extra receptor. They block 5-HT receptors. 5-HT. That's what makes them atypical. They antagonize 5-HT receptors. That's a serotonin receptor, technically. So that makes them different. Okay, now, one of the other things I want you to know, in the atypical side, if it ends in pene, olanzapine, which is Zyprexa, clozapine, Clozaril, and quetiapine, Seroquel, pene, those are the ones that are less metabolically favorable. Okay, so they have metabolic syndrome, hypertriglycerides, hyperglycemia, weight gain, hunger, increased risk for diabetes. Those would be worse than the other ones, technically. So again, they all block D2 except for these three, which are partial dopamine agonists. The atypicals are atypical because they antagonize 5-HT serotonin receptors. Now, all of them hit other receptors too. So they all hit alpha receptors. Okay, all of them. They all hit alpha receptors, every single one of them. Okay, but just to varying degrees. They all will hit histamine, only to varying degrees. Okay? And they will all work on the prolactin system. I'll put that over here. But just to varying degrees. And they will all, I'm just trying different colors here. They will all work on muscarinic receptors, which, if you recall, is an anticholinergic receptor. And there's a mnemonic that I learned in medical school that you should probably know, which is mad as a hatter, blind as a bat, red as a beet, hot as a hair, dry as a bone, and the heart runs alone. So mad as a hatter means confusion. Blind as a bat, they get mydriasis, pupil dilation. Red as a beet, because of vasodilation in the peripheral, they'll get flushing. Hot as a hair, so they get hyperthermia. Dry as a bone, they get anhidrosis. Basically, they're not secreting sweat as much. And heart runs alone, they get tachycardia, heart rate tends to go up. So that is just from those muscarinic receptors. Now, you don't have to memorize side effects, because if you know the receptors, you know the side effects. So boom, if you understand that it hits the muscarinic receptors, you can anticipate any of those side effects. If it hits the dopamine 2 receptors, you know it's going to give something called EPS, movement side effects, which we'll get into. If it hits histamine, then you know it's going to cause dryness and sedation to some degree. If it hits alpha, those are found in the peripheral vasculature, and actually multiple vasculatures in the brain, and they hold the integrity of the vessel. So if you block alpha, you actually vasodilate and you get hypotension, orthostasis, reflex tachycardia. The patient will present as dizzy, technically. Okay? So these are all the receptors that they hit. Let's take a break right there.